Welcome. Thank you for sharing this next 50 minutes with us. I'm Bobby Jefferson. I'm on the SID board and the executive committee, but you didn't come here to hear me speak. You came to listen to the experts. So on my right is Courtney Bickert, who will talk to you at the end around a fascinating topic that is the first time SID has had this topic. Amy, fantastic speaker, TEDx speaker, world-renowned book author in this topic around mental health and fitness. And so I've heard speak before, was suitably impressed and just want to keep that connection going. And then Ting Shih, CEO of ClickMedix, but has been involved in some fantastic work around dementia and dementia patients. And so I just want to offer up in the beginning, this is a safe space. Please stay engaged. The topics that we're going to talk about are a bit sensitive, right? It's around mental health awareness. So just letting you know in advance that, please be engaged. And if you feel uncomfortable, just let us know, because this topic is all about ourselves and self as well. So what I'd like to do is I'm going to turn it over to my wonderful colleague, Ting. The format is that each presenter will share some slides, talk through, and then immediately Q&A. So that way you can ask your questions and just be much more engaged. So we're not going to do a Q&A at the end. After they finish the presentation, we'll just go through each of the questions. And then when we get the 5-minute warning from SID, then we'll wrap up and begin to end. So again, this is the first of its kind session, along with the art one that happened earlier at SID. So if this works, we can make it the bigger panel and the bigger stage, but we will at least use this as a way to introduce the topic. So please let me introduce Ting and get started.
Hi, everyone. My name is Ting, as Bobby introduced. And my journey with mental health technology obviously didn't start there. It started while I was a graduate student at MIT. And MIT, there's a class called Development Ventures. And the only assignment to tackle was create a business that will impact over 1 billion people. And I thought, obviously, it has to include technology, because how else are we going to tackle problems of 1 billion people? And obviously, we have to start with somewhere where there are no doctors and a ton of patients and no expertise, that we're just destined to fail. So we started in Botswana, where there was, and let me time frame it, it's 2009. There was literally one oral surgeon for the entire country in the public health system for Botswana, yet there are 1.8 million people who may have oral problems, and some of them cancerous. So we thought, can we use technology? And at that time, it was a mobile phone, because everyone may have a mobile phone even before they have electricity or clean water. So we thought, okay, let's put a little program on the phone. It will then have questions as if an oral surgeon, world famous cancer doctors there, and asking the questions about the patient, trying to figure out what's wrong with the patient. We put that little program on the phone and have the local nurses just follow through. How's the patient feeling? Take a picture. Does it look like a white mass inside the mouth? Well, that could be cancer. And then refer for treatment and follow through. Sorry, I need to point this way. And that started the idea of, okay, how can we do this? So a woman comes in, she gets screened, it's phone or tablet. They go through these series of questions, and then we capture the intelligence of the expert. That's why we're called ClickMedix, click to medical experts, the remote experts questionnaire, and their risk triage of, is this cancer? It's not cancer. And what to do about it. And that's probably the most important thing. A lot of technology would say, yes, the diagnosis is this based on, millions of images I've read. This is a diagnosis, but what are you going to do about it? Is there medication? Is there a doctor? Is there treatment? So then locally, well, where can the person get treated? Can they afford the treatment? Is there a public center that has the expertise to do the surgery if needed? And then obviously the follow-up part. And all of that feeds into an ever learning system that's learning, here's what the doctor said you should do. Here's what we actually did. Here's the outcome. Now, can we self-learn from this process? And we did that in Botswana, and we did a quick ROI just on flying that single oral surgeon around the country. It was over $1 million in savings a year. The government of Botswana took it up and developed their own mobile health institute and their very first medical university, along with University of Pennsylvania, which was our partner at the time. So we thought, can we do this in India? Can we do it in a country that's super populous, urban and rural at the same time, but has good technology infrastructure? And same problem, I'd say a lot of people, but medical expertise is lacking in terms of the ratio of doctor to patients. And when we worked together with Medtronic, and we taught health workers to screen for ear infections. And we picked things that were very visual at first, because it's just easy. Take a picture, get a diagnosis, and what to do about it. So we did this over and over in 25 countries with different diseases, over 2 million patients. And we've done this in diabetes, heart disease, and most recently in mental health, including the US. Some of the mental health issues we deal with, easy ones are your depression, anxiety. Hard ones are your clinical, bipolar, epileptic, and so many different psychotic. And our experts are the ones that work at mental institutions. We call them the psychotic whisperers. You know, a patient may be hallucinating. They're, chasing butterflies. And in the expert's eye, they're like, oh, he's just mentally having a field trip. It's fine, nothing dangerous to himself or others. We don't need to medicate him. So these are some of the expertise that we're learning. And as we look at, obviously, we just had a session on AI. You can shortcut the whole AI trying to predict what to do process if you incorporate what will the expert of today do, but enhance that by collecting, here's what the experts would do in India, here's what they would do in US, here's the outcome, well, what should we do altogether? And that's where I see the power of AI, and that's where I see a way to evaluate whether that technology is going to work. So capturing all the lessons we've learned across the world over more than a decade, some of the lessons learned on if a patient has a problem, mental health, dementia, whatever it is. First thing is figure out if that's the right diagnosis. Particularly in dementia, there's so many misdiagnoses, underdiagnoses. People don't know they have a disease. And getting the right diagnosis certainly is the first step, because then the next is now who can treat that problem? Then what you probably need a team around it because you need to finance it, all of that. And all the barriers, is it family? Is it money? Is it housing? Is it food? I mean, a whole lot of that. So going back to how we started in Botswana, trying to find a very hard problem to tackle, we decided we need to tackle dementia. 1 in 4 people, 85 and above, would die of dementia in America. The stats are similar in almost every other country, and we're all aging. It is a crisis, it's a problem. 6 million people, $20 trillion, that's what we're looking at in about 10 years, all dementia related. And the solution components, one is awareness. A lot of people don't know about the disease, that you could screen for it and treat for it and all of that. And where the AI comes in, which is fascinating. And I mentioned this, let's say I'm a dementia patient, I just did this. Oh, it's supposed to fall, it didn't. But I just did that. And someone might say, oh my God, the patient is getting violent and might be hurting others. But really, for a dementia expert, it would be, maybe she just doesn't want water. Maybe she wants tea. So someone who's aware of it would then, give me tea. And if I don't flip it over, oh, the right intervention was made. She just wants a different beverage. So we do not need to medicate the person. We can use this type of behavioral explanations to understand. And if we do that with different patients, different behaviors, and that's where you can apply AI to almost pretend you have an expert who can see and interpret what's going on and try to address the problems. And again, very, very similar process, and there are many, many different kinds of assessments in terms of figuring out what to do. And this is where the technology pieces come. There are so many technologies for different interventions, but it has to be fit for purpose. You know, is this assessment approved and used by clinicians to actually treat hundreds of thousands of patients? Is this home safety device that's supposed to detect falls, is it being used? Is it FDA approved? Is it working? And just simple pictures like this, which is this person a danger to themselves because they have so much clutter in a house, they'll probably trip because someone with dementia would be shuffling, gait disturbance, and they might trip, there's a loose carpet. So these are the things we can look at and train technologies to help us. These are motion detectors, so on and so forth, and others, virtual visits, and ultimately, whatever technology gets selected for mental health, whether it's for you, your family, or your programs, it needs to be fit for purpose. And it needs to include an education component that then informs not just the patient, the caregiver as well, and those who are going to work with the patient, the doctors and nurses, and have a training program. And then here's where the AI comes in, interestingly, is aggregating proven information. If you ask ChatGPT, patient just knocked over a bottle of water, they're going to say, well, you know, see, and person has a mental disease. And they would say, okay, talk to a doctor and do this and that. But with this aggregated information, the next question would be, okay, try a different beverage. It would really mimic what an expert would do to try to manage that behavior. And that's where I think the AI could become helpful and purposeful in terms of addressing diseases, mental health, or otherwise. So thank you so much for listening, and I welcome your questions.
So any questions? Great, I have one. So how, so with mental health and especially with dementia, how do you access, patients can have access to caregivers? How is this coded within the mental health system? So for reimbursements, especially in the US, you know, my insurance always looking for reimbursement ICD codes and DRG codes, as you know very well. So how does that process work? And what is the most important part of the assessment around dementia? Like, do you need experts in the system, remote? Like, how does that work?
That is an amazing question. In the US, there hasn't been any proven code or payment scheme for dementia. And the data has been telling the government it's very expensive. As a caregiver, $13,000 more per year if you're a caregiver of someone with dementia. And literally, as of December of last year, CMS launched a new initiative called
What's
GUIDE,
CMS?
Center for Medicare and Medicaid Services. The Department of Health in the US launched a new initiative that says, if you can form a consortium of care navigators, nurses, doctors, home care assistants, and tell us how you're going to address everything we talked about with dementia, we will pay you $100 to $300 per member per month. It's essentially an insurance or membership scheme that could then become a payment scheme that demonstrates value-based care and that there could be cost savings overall to address this problem. And you mentioned assessments. Assessments, you know, PET scan would be one. Genetic testing is brand new in terms of whether someone has dementia. And a number of assessments, these are questionnaires, can be the first step to see if there's something more serious. Usually a formal diagnosis made by a neurologist, but it could take 2 years to do that. Or you could do a telepsychiatrist consultation that could give you a pretty definitive answer.
Great, thank you. So please give Ting an. All right, our next speaker is Amy.
All right, I hate standing behind tables, so I'm coming down here. All right, so have you ever wondered why certain people handle stress and change better than others? I see some nods. So your level of mental fitness is the best predictor for how happy you are, how well you perform relative to your potential, how well you handle stress and change. The bad news, 80% of people score below the minimum level of mental fitness required to live to their potential, to be able to handle the stresses and changes that happen all around us. The good news is that just like physical fitness, we can improve our mental fitness with practice. So that's what we're going to go through today. But what is mental fitness anyways? So mental fitness is essentially your capacity to respond to life's challenges with a positive rather than a negative mindset. So what does this mean? I'm going to use a physical analogy to bring this to life. Okay. So if we all had average physical fitness, then you could probably climb the hills of life with relative ease. But what is in front of many of us today is like this big mountain of challenges with race relations, politics, wars, everything that is happening in the world. And so if we put this big mountain in front of us and we're trying to climb it and we have average fitness, what would happen? As you're climbing it, your legs start shaking, your heart starts pumping, you sweat profusely, and you can't breathe, right? And that's exactly what is happening with everything that is in the world today. We have this big mountain where we have average mental fitness. And the way to think about this, continuing with this analogy, is if we could pose the question, what if this mountain is just a mountain? And I don't have to blame the mountain for causing my stress, my frustrations, all that stuff, right? What if the question that I could pose is, how can I strengthen my mental fitness enough so that I can get over this mountain, right? And so that's what mental fitness is all about. It is about being proactive. It's like if you were about to run a marathon, I don't know about you, but I would have to get physically fit ahead of time to run the 26.2 miles. There might be some of you that don't have to do that. I have to. And I'm guessing most of us have to do that. And the same thing is true with mental fitness. We know life throws fun stuff our way all the time. And so we have to get mentally fit ahead of time to be able to handle that. And so if you're looking at the folks around you that are able to handle the stress, the changes, it is because of their level of mental fitness. So why do you think mental fitness matters? It all comes down to our thoughts. How many thoughts do you think we have per day? Throw it out. 1 million, billion, close. 12 to 60,000 thoughts per day. Close. How many of those do you think are negative? What percentage of those do you think are negative? 90, 50, so a huge range. It's 80%. So 80% are negative. What percentage do you think are repeated day after day after day after day? The same thoughts of those 12 to 60,000. Throw out a percentage. 50, 40, 80, 95%. So you have 12 to 60,000 thoughts per day. 80% are negative and 95% are repeated day after day after day after day. And what consumes your mind consumes your life. And a lot of this is happening unconsciously. So with mental fitness, it's all about how do I bring all that is happening unconsciously into the conscious, right? So that I can handle what is happening. So how do we build our mental fitness? I'm going to start with the research. It's called Positive Intelligence, conducted by a man named Shih. He conducted it on over 500,000 people. We only have 15 minutes for me, so I can't go through the research with you. But if you want to buy the book, it's on Amazon, 20 different languages. You know, you could read all about the research. But what I want to share with you is that his research found there are 3 core muscles to mental fitness. The first is a saboteur interceptor. The second is your sage. And the third is your self-command muscle. And if you're wondering, what the heck are those? I'm glad you asked, because that's what I'm going to go into really quickly right now. And before I jump into the muscles, I want to use an analogy, and it is Jedi mind training. Who is a Star Wars fan in here? All right, great. So mental fitness has lovingly become called Jedi mind training. And why is it Jedi mind training? It is because we have these 2 characters in our head, Darth Vader and that inner Jedi. Who has ever experienced these 2 characters in your heads? I see some smiles. I think you're aware of them. So, you know, we have these battles in our head between the Darth Vader and the inner Jedi. And that's why one of them, the characters, the saboteur is essentially that Darth Vader. The sage is essentially the inner Jedi. And that's why 2 of the 3 muscles, one is the saboteur interceptor. It's how do we intercept that Darth Vader that's messing with us? And the other muscle is the sage. How do we strengthen that inner Jedi that's in here? Okay. So let's start by talking about the saboteur-interceptor. And we can't talk about saboteur-interceptor without talking about survival. And what did we have to survive from? It was this thing, saber-toothed tiger. So back in our cave days when this thing came, I had to know, do I fight, flight, or freeze? Okay. I also needed to be liked by the tribe. And this was for survival reason too, because if you think about it, am I more likely to survive if I'm with a tribe or if I'm alone? And so that's why our brains, although it's amazing, still has not evolved from that survival mindset. And that's why I'm still looking around and saying, are you my friend or my enemy? Are you going to accept me into the tribe? Am I saying something that would be booted? Right? And so we're constantly assessing and judging if we're going to get booted from the tribe. It's for a survival reason. Right? And I'm looking at everyone and deciding, are you my friend or my enemy? So we're constantly assessing and judging ourselves and other people, which is why the research has shown the top saboteur that every single one of us has is called the judge. Okay? And the judge judges in 3 different modalities. The first is one that you're probably very familiar with. It is judgment of self, also known as the inner critic. It is the thing saying, oh, what's wrong with you? You didn't get the promotion. Oh, you're going to fail at the thing. Right? It's constantly assessing and judging you for past imperfections and future failures. The second modality of the judge is judgment of others. It is the thing looking around, oh, you're too tall, you're too slow, you're too dumb, right? Like it is assessing everybody else around you. And the last modality is something many of us aren't even aware we're doing, but it is judgment of situations and circumstances. It is the thing that says you cannot be happy until you have a title, a salary, a house, a family, a whatever. You cannot be happy until. And if you really think back to all of those, you can't be happy untils, were you happy when you actually achieved the thing? Right? So that's how the judge judges. It judges in these three different ways. And the research showed judge has many friends. It has 9. And those are the avoider, controller, hyperachiever, hyperrational, hypervigilant, pleaser, restless, stickler, and victim. What a cast of characters. And if you're looking on there and thinking, oh yeah, my boss has the controller, they like to micromanage me, or my partner has the avoider, it drives me up the wall, I encourage you to focus on your own saboteurs. Because I promise you, it is the judge along with some of those saboteurs that mess with you, that mess with your own stress levels, your happiness, your ability to perform relative to your potential. Okay, at the same time, don't feel bad because all of us have it, right? And it's that recognition that all of us have it that helps us also build our empathy muscle, that everybody else in here is dealing with the same thing, okay? And so it's about recognizing, which do I have? How does it mess with me? For example, I have hyperachiever, and I know how it messes with me is at 9:30 when I'm thinking about going to bed, it says, just one more email, just one more thing off your list. It'll make you better, right? And I'm like, And now I can catch it. But before I couldn't. I'd be like, oh yeah, okay, one more thing. Okay, so it's becoming aware. It's bringing that stuff that's unconscious into the conscious so you know what's happening so you can intercept it, okay? And it's almost like creating this wanted poster so you can catch it faster, right? That's the whole objective. You cannot get rid of these things, but you can minimize the amount of time you spend in it. So if you're more aware of it, you can minimize that amount of time that you're in it. The second muscle is the sage. And the sage, I'm gonna just share something. So from the research, the sage and saboteur operate in different sides of your brain. They trigger different emotions, beliefs, thoughts, okay? I could put your head into an MRI machine and actually see which side is being activated. So there's a lot of science behind this. And the sage comes from a sage perspective, which says every outcome or circumstance can be turned into gift or opportunity, including everything that's happening in the world right now that sucks. And if your saboteur is triggered right now, it will say she's bananas, get her off the stage, what is she talking about? But if your sage is online right now, it will know that is exactly how the world works. And often I get a question from folks, which is, which perspective is true, saboteurs that this is bad, or sage that everything is a gift? And the answer is whichever you believe becomes true. There's a saying, where focus goes, energy flows. If you left here and decided you're gonna go buy a red Jeep, You're going to leave here and see what? A lot of red Jeeps. Is it because everybody decided to buy a red Jeep? No, it's because that's where your focus is. So you can choose, do I focus that everything is bad, or do I focus on everything there's a gift or opportunity? It might not be clear in this moment, but you will know later that yes, there was a gift or opportunity from that thing that happened. And last muscle, so we went through the saboteur stage, last muscle is self-command muscle. We're not gonna have time to delve into this, but what I wanna share is that this muscle essentially helps you to shift from saboteur to sage. Because when you're triggered by your saboteurs, it is hard to say, what's the gift or opportunity here? So this last muscle actually helps you build that muscle to help you shift into this calm groundedness that you can pose that question, all right? And so think of today as like watching a 5-minute YouTube video on how to ride a bicycle, okay? And so I encourage everybody, let's keep working on strengthening your mental fitness muscles. This is just the start of the journey. And yeah, that's it. If you want to connect with me, I'm on LinkedIn. Yeah. Thank you.
So please, any questions? We'll have, and we'll have an online, there are people online.
Thank you. Can you talk just about when mental fitness should start? It seems as though from an early age.
Oh, yeah. So ideally, we would have all gotten this in school when we were younger, right? And the fascinating thing is, if you were to put a child's head into an MRI machine, both sides could be activated, the saboteur and the sage, because it's good to sometimes have that survival side, because if the tiger comes your way, you don't want to say, oh my gosh, cute, cuddly tiger. But if there's no tiger, you don't want to be spending your time there. So as children, we could activate both sides. I could see that activity if I put your head into an MRI machine. Into adulthood, one side quieted and one side got louder. Right, guess which one? And so the goal, and I know a lot of folks who work with kids on building their mental fitness from a young age. Because imagine if we had this when we were younger. Yeah.
Anyone in person? I have a couple online. Okay. Yeah.
Mhm.
All right. This is from Ajit. How do you distinguish, Amy, the differences between mental fitness that seems to be more related to emotional well-being versus mental health resilience, bouncing back from adversity in a sustainable way?
So mental fitness is all about being proactive, and it is about resiliency too. It is when stuff happens, how do I see the gift or opportunity in it, right? And I think of the difference as mental health is like, oftentimes there's something wrong, whereas mental fitness is we all are exactly where we need to be as a starting point. And like if I were to look at physical fitness as an analogy, there's a guy, his last name is Maynard, and he climbed Kilimanjaro without arms or legs. Okay, and so the idea is you can get as mentally fit as you want, no matter where your starting point is, and there's nothing wrong with you.
Great, thank you. All right, you have another one from Dr. Naomi Levine. I'm hearing a lot of individual responsibility and individual action talk on this subject. What can we do to change systems to enable us to sustain good mental fitness?
That's such a good question. If you could give me the answer, I would love that. I think it really is about finding leaders and helping them to recognize the importance of mental fitness. So a lot of times, like I go into organizations and I actually help the leader improve their mental fitness. When they are able to see the benefits, then they will systematize it and implement it for everybody else. But if they're not seeing the benefit of it, it's not going to impact the systems, unfortunately.
Well, that's all the questions we have for now. Please just give an applause to Amy. Thank you. And over here. So since this conference is about the sparks of hope, the one session that we've included has been my dear, dear colleague, Courtney Bickert. So Courtney, I turn it over to you.
Thank you. All right. How you guys doing? Bit tired. We're going to start our journey to mental fitness right now and start thinking positive. So what I want to start with is we're going to get in the mood a bit so that we can really recognize those sparks of hope and we can recognize the gift. So first of all, I want you to think for a second, and you can then share this with a colleague or with the group, something funny that happened to you or you did or saw in the last day, the last week. Could be something that made you laugh. It could be something that you were like, huh, that's weird. So it doesn't have to be a laughed out loud thing. I'll give you an example of mine for the day. Was this morning I was turning off the news as I was heading out to the gym. Still makes me giggle. And my gym is like a block away. So I got there, I got on the treadmill to put my phone in, and I had brought my clicker for the TV with me to the gym. So I was like, well, that's helpful. So for some reason that made me giggle, and it still makes me giggle just thinking about it. So think about something funny. May have happened in the conference today, on your way here, airport, train travel. Anything come to mind? Traffic? Yeah?
I fly out on Monday, and I've been freaking out for 3 days that I didn't have my driver's license.
Uh-huh.
Couldn't find it anywhere, looked everywhere, couldn't find it. I go to the DMV, which we all know how much fun that is. And the driver's license, I go to pay for my driver's license to get a new one, sat for an hour in line, and there it is in my new phone wallet right there. I looked everywhere, and I swear that either God or my kids are playing jokes on me. Because the police officer helping me was like, ma'am, why don't you give me your ID? Oh, there it is. Yeah, jokes
Yeah.
on me.
I found my earring in my cowboy boot once. I don't know how that happened. Yeah?
I don't know if anybody else relates to this, but especially when we're kids, we have some water in our mouth and it just slips out of our mouth a little bit. Maybe you've laughed or something. And then so today at lunch, I was across from somebody who had drank some water and some water just kind of slipped. And she was like trying to hide it and everything. And I thought to myself, no, let's embrace it. That's awesome. I remember those moments. That was so fun.
That's awesome. So you have all afternoon or the rest of the afternoon to continue to share. But what just happened is actually the people in this room, you're in a better mood. You're probably calmer, a bit more relaxed, and you're closer to one another, whether you know it or not. Okay, I'm going to do you one better in terms of upping your mood. If I can find the slide. Then which way am I going? Am I going in the right direction? Yeah. Okay. Now, how can I hit play on this thing? If it doesn't work, it's not the end of the world. Okay. You don't need to be able to hear it. Okay, we can hit pause. Okay, that went on for an hour. For that commercial was like 10 seconds when it finally was filmed. But what that shows you is how you've had that when you're in the lecture hall, right? And you're like, it's completely inappropriate, but you cannot stop. And then all of a sudden the person next to you is laughing and you might start laughing. And then by the end, you have no idea what you're laughing about, but you can't stop. And that's because laughter is actually contagious. And now I'm going to do one thing better. We're just getting our mood and our minds. We're going to talk about how this is affecting our minds too. So a priest, a rabbi, and a nun walk into a bar. But the bartender says, "Is this a joke?" Not very funny joke, but it had the intended effect, even though you didn't laugh out loud. So let's go a little bit into what's behind all of this. There's actually science behind this. There's actually a term for the study of laughter. It's called gelotology. I think it's kind of a funny word, actually. But there is a lot of physiology behind why this works. So laughter is actually, it's a recognized emotion that is one of the universal emotions that we all have and can recognize, every single one of us. There's a belief that it's very heavily connected to evolution, and actually that laughter, and even animals can express some form of laughter, is actually a sign that it's okay, I'm safe, I'm not your enemy. So that's what they believe the evolutionary purpose of laughter is. And so you can imagine that it's kind of a natural for us to trust someone, to be closer to someone who's laughing with us or laughing, because it also shows that they feel safe and that they're not a threat to us. So just like we know negative emotions, right? They're connected to cancer, stress, heart disease. We know that positive emotions, now with the thanks of a lot of study, are also related to positive health outcomes. Just when you laugh, you're actually improving your circulation. You're actually, the way that you're taking up oxygen, your use of oxygen is more effective, more efficient. The moment you laugh, your blood pressure shoots up a little bit and then goes down even further. So you're much more relaxed. So there's circulatory benefits, there's heart benefits, there's the reduced stress. Our muscles become more relaxed when we laugh. So this is why laughter reduces our stress. It makes us mentally and physically, it improves our well-being. It also, because it takes the cortisol out and replaces it with dopamine. And dopamine is the memory and the learning and the connecting part, hormone. So we get dopamine, take out the bad stuff, and we also get the empathy hormone, which is oxytocin. Thank you very much. So we get the empathy hormone. So again, that closeness. Now I'm going to talk about humor, right? Oh, I have the clicker. I was like, somebody change the slide. Did that not work? Humor. Lucille Ball, she's amazing. Groundbreaker. But humor, interestingly enough, though humor seems more kind of cerebral, it also has physiological effects. So humor is about changing the script. It's about when the script is changed on us. So actually our brain, when I said a rabbi, a priest, and a nun walk into a bar, right? I'm setting a script, we've all heard it, but we know what's coming next. And our brain is thinking about, is it gonna surprise me? Am I gonna be surprised? Is it gonna be better than I expected? It's gonna be worse than I expected. And your brain going through that process is actually using your inferior, I'm almost done, your inferior, your posterior, and your anterior brain lobes, basically everything in there. That's also releasing dopamine, also making us closer. It's also making us more relaxed. It also makes us appear more confident because we're relaxed, we're confident. So that's humor. And it is universal. You know that saying, no, he doesn't have a sense of humor. Everybody does. We do. And I'm going to move to the last point. God, why do I keep thinking I'm guiding? I'm the director here. I should be directing the show. Oh, we've talked about that. You can also use this really effectively with teams. Teams that laugh together, stay together, work better, more innovative, more creative. So how do we bring it into our lives? Sorry, I love this. Don't sweat the petty stuff and don't pet the sweaty stuff. George Carlin, a genius. But just take notice when you're walking. Funny stuff is happening all day, all around you. So take some notice. Share something funny with your friend or your colleague. If you're walking to a meeting, tell them what you did that was funny this morning about the clicker in the gym or whatever. Start your meeting with something funny that you did. Find opportunities, inside jokes with colleagues. I just saw a former colleague of mine. We haven't worked together in 10 years, and we were busting up over an inside joke. So listen, watch, read, and share. And that's what I have for you. After your questions, I'm going to have a little challenge for you for the rest of the day. Any questions?
Questions? We'll check on the online one, and I have one as well.
Okay, this is, yeah, for Courtney. Have you seen Donors Fund Laughter and International Development? If so, how has that been successful?
My
Or if
phone number
not-
is.
if not in programs, which PBOs in the development sector regularly use laughter in their workplaces or in working with stakeholders?
Well, gosh, I'm going to start a new business. No, I have not heard of it funded explicitly at all, actually. And it is really interesting because cross-culturally, humor and laughter work. Laughter is universal. And if you tell a joke that somebody doesn't get because it's cross-cultural, it's still what they're already thinking in that safe way. And then they can be like, I don't get it. What your aunt did what? Why was that funny? And then they get to explain in a really safe way. So I think, and it works great for teams, especially teams under a lot of stress, like the ones we work with. So. But no, I haven't heard that. Yeah, but it's for the online people.
No, this is more of a comment, but I think going back to. Okay. There we go. But implicitly, I think, that, for example, I was at a company recently that I wasn't laughing. I didn't laugh for 6 months straight, I think. And I ended up coming back to a company because my boss was like, come back. But I belly laugh twice a day now. And they're like, why did you leave the other company? And I cite this as my example. And I'm like, it's just a proxy measure, I think, of like a good culture. If you can laugh with your colleagues, but I've never sat in a session like this where there's actually science to it. So,
USA should fund it. You know, they've done all this really crazy research about the innovation of teams that laugh together. They've showed teams like MIT did this research. They showed a team 5 minutes of comedy and another team nothing, and they separated. They gave them the same questions, and the teams that laughed or saw comedy, because it's also just the nature of hearing a joke, makes your brain open up and think different ways, came up with like 38% more answers that were judged like 50% more creative by the professors who judged it. So
my question is, I work in a number of countries, Haiti, Ukraine, in which the staff are under a lot of mental stress,
yeah,
and deal with crisis each day. What approaches can be used or leveraged to help them, either through mental fitness or through humor and laughter, to be able to deal with and address each day that them and their families have to go through on a constant basis?
Yeah. Amy, do you want to take the... okay, I'll start first. Yeah, well, what you'll notice is that people in horrible, horrible conflicts, they do still laugh, actually. And there actually is a thing called gallows humor too, which is, you know, a darker form of humor. But I did a really interesting workshop with conflict negotiators and how they were using, some of them actually got out of one in particular, a hostage situation in Nicaragua by using humor. And his captor let him go, actually. But it is a way to deal with a lot of stress, and there are a lot of ways to facilitate, let's say it's a team working in a conflict zone, to help them relax through using some humor. There's lots of ways to do it. And Amy, I'm sure you have thoughts on that as well from mental fitness.
So from a mental fitness perspective, it is, and the person that comes to mind for me is Viktor Frankl. It's no matter what situation you are in, can you find the meaning behind it? Can you find that greater purpose? And it is, and that's the sage perspective, which is what is the gift here? What am I doing this for? Why does this matter? Versus the saboteur perspective. And in every single person's life, we have moments that suck, right? And it's oftentimes we try to compare to like, oh, but that person's situation sucks more than I do, so I shouldn't feel so bad about it. But we shouldn't be comparing it. Our moments suck, and can we look for what's good and or the opportunity or the purpose or the meaning, and that will help shift our perspective and how we look at things.
Any other questions? Are we out of time? Probably.
Well, we do have one last question.
Okay, and then I
Before-
want to
can
give
we
one
switch
last
over
chance.
and then you'll do your final thing.
Yeah.
This is a question for you, Ting. So Ajit asks, well, he referenced a 60 Minutes report featuring a mental health app called Wobot Health. But in the countries in which we work globally, how could risk of using technology for mental health services, culture, language, stigma, and for particular populations, privacy, whether disinformation, especially vis-a-vis political processes, election, media, or unique groups, for example, gay or trans folks, where their lives are criminalized, be mitigated? So I'll try to say it one more time. In the countries in which we work globally, how could we risk of using technology for mental health services and for particular populations, privacy, be mitigated?
I think while apps are great, particularly for self-assessment, some peer support, I think ultimately, if you think it's severe enough, you should see someone who's licensed, professional, clinician, and have their own proven methodology to actually treat patients. Mental health is a disease, it's an illness. There are proven pathways to treat it and manage it. And I think, while everyone hopes there's an app that will solve my mental health and depression, I think ultimately it's a way for you to recognize how severely ill you may be and what help you need. Because once you get to the licensed professionals, data privacy, confidentiality, that's already secure. There are rules and laws and regulations around that. But if you go off, it's like going to WebMD. I mean, when I do it, usually I end up with lupus or cancer. And I go to my doctor and they tell me I don't have that and spend a ton of money getting scans that says, no, I don't have that. So sort of thinking of it that way.
So we have 30 seconds left. So yeah, I just want to allow Ting to leave a takeaway, Amy to leave a takeaway, and then we'll end it here. Yeah, so Ting, please leave a takeaway for the.
I think one takeaway is while there are a lot of technologies out there, ultimately you need a professional who's gone to medical school to treat your exact disease and have learned from other patients, many of them like you. And I think technology is great, but just evaluate and look at the background. We call it vaporware, right? So when it's vaporware on social media, fine, it ends up being marketing and all of that. But when it's your own health, you really, really want to do the due diligence. Who's behind it? What's the science behind it? Beyond the marketing and sales pitch, are there actual doctors and patients benefiting from it? And really use that to assess it. And I think also just be aware of mental issues and just educate yourself on it for yourself and others that you care about.
I would say start being proactive with your mental fitness. Don't wait until marathon day to start training. Start working on it right now, and becoming aware of your saboteurs and even those around you is super helpful. For example, I have a strong controller. My husband has a strong avoider. So imagine how they like to play with each other. But because we're so aware of our saboteurs, we understand now, right? And so the fights we used to have and the conflicts we used to have are no longer conflicts because we understand that about each other, and we can laugh and be playful about it, So start being proactive.
I am. Let's see. I'm just going to share. Sorry. Technology is not my focus. Sorry. This is not what there we go. Okay, so I guess my takeaway is find something funny every day that makes you giggle or makes you curious, and share that with your teams or with your family or with a friend, so that you can bring that and to them. And then this is a nice thing. It's a challenge you can use during the reception if you so choose, with each other, or it's a nice way actually to facilitate something because what you're providing here is a setup. So you make it easy for someone to make up their own joke. So you know you've been to too many. I know I've been to too many conferences when fill in the blank. I got off the wrong elevator and sat through 3 panels before I even realized I was at the wrong one. You know, so you can come up with, or a development professional by the decorations in their office. I mean, so you can do any of these. You can use these also with your team to create inside jokes. You're working at XYZ company. You're working at our company when blah happens. And it opens up it enables your teams also to kind of criticize in a safe way and make. So that's what I would like to leave you with. I challenge you to make some of your own jokes today.
And the speakers are around, so if you have follow-up questions as well. So thank you, everyone, for attending this pilot session.